Now, urinary system, for our purposes, is very, very simplistic. What is the urinary system? Urinary system, not system, urinary system does the following. It filters blood and makes urine. That's what the urinary system does. So every time a person goes to pee, you are actually peeing out the waste product that your body took out from your blood. Look at this. Urinary system filters blood and makes urine. Urine is the waste product that's removed from the blood. It's made up of several components. It's made up of kidneys, ureters, and bladder, and one last piece known as the urethra. Now, to put it in the proper perspective, all right, if you have the human body, okay, yeah, I know, this little guy looks insane. All of this is in the belly, okay? So you got your esophagus going down through the neck, through the chest, then ends up in the stomach, and in the small intestines, blah, 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 then in the large intestine, yada, 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 and out it goes somewhere in the back, okay? The kidneys are right over here, and this system is right there, and there it is, and out it goes this way. Okay, so that's where these things are. Towards the back, okay, they're about the size of your fists, these two kidneys, and their job is to filter blood and make urine. Kidneys, medical term is reno and nephro. Reno and nephro. Kidneys filter blood and make urine. Ureters are simply pipes that take urine from the kidneys to the bladder. Now, if you remember, we see the term bladder a little bit earlier, and we said that bladder, medical term for bladder, is cysto. Okay? In this particular case, it is the bladder that stores urine, and this bladder is called urocyst, or urinary bladder. Urinary bladder. Urethra is the pipe that goes from the bladder through whatever passageway you have. If you're a man, it goes through your penis. If you're a woman, well, urethra is a little bit separate, but in a close neighborhood to the female genitalia, even though for a woman it's separate. And as we do the reproductive system in just a few minutes, you will see where the urethra actually is. There are no more, how can I put it, secrets here. There's nothing else for us to discuss. I don't have to get into the kidney and show you how that works. That is unnecessary. But these basic components you must know. So far, so good? Okay. And the reason to know these is because you're going to be performing procedures on instruments known as cystoscopes. And where do they go? Into the bladder. This one. Make sense? I hope it does. All right. Let's move forward. Let's do the reproductive system. And we're going to stop with the reproductive system. Actually, I might even do a little bit of a nervous system today, too.
Excuse me, Steve.
I am here.
I just wanted to ask, I know that in the medical field, the left and right are opposites when you look at them on the board. This picture is the same, correct?
Yes.
Okay.
Very good question. Very good question. That's why when I drew the picture of the digestive system, I made sure to let you know that this is where it's at. All right. So it's kind of reverse, right? If you're looking at me, this is my left, not your left. It's your right, but it's my left, right? That's how you look at the human body, from the perspective of the body, not your perspective. Make sense?
Makes sense.
Okay. Very good. Now, let's do the reproductive system. All right. Which one do we start with, male or female?
Female.
Anybody? Female?
Female. Female.
All right, female. All right. Female it is.
Yes, yes.
Female reproductive system.
What do I need here?
Now, the centerpiece of the female reproductive system is this interesting organ. This is the female reproductive system. Now, what did I draw here? This is the uterus. This is the vagina.
What was the question? I froze a little bit.
Folks, make sure to keep your mics muted. Uterus, vagina, ovary, fallopian tube. Now, medical terms for vagina. One will be vaginal, and the other one will be colpo. Uterus. Medical term for uterus would be utero, metrio, and hystero. Medical term for ovary would be ovo and oophoros. Now, fallopian tube, medical term for fallopian tube, or actually tube of any kind, would be salpingo. There's a lot of medical terms here. Now, ovaries, what do they do? Ovaries make female hormones and mature eggs. women are born with all eggs inside their uterus. So when a little girl is born, she has inside her ovaries a bunch of eggs, which she's going to have for the rest of her life. And one at a time, on a monthly basis, she is going to mature one of those eggs, which are going to come out of the ovary through a cyst, which contains that one ovary. That cyst, not ovary, that contains one egg. That cyst, poof, explodes, and the egg is picked up into the fallopian tube. And this egg travels from here to here. Hoping like crazy that this little egg is going to meet her friend, the sperm cell, and they're going to get together and make a baby. The egg gets fertilized in the fallopian tube and then travels into uterus, where it gets stuck on the inside of the uterus and begins to grow into a baby. Okay? Earlier, when we were talking about cysts, we were talking about these cysts right over here. And sometimes these ovaries, due to various hormonal issues in the female body, which are very complex, a woman's hormonal cycle is very complicated and is completely and totally inconceivable to the male mind, to the male nervous system. Men could never tolerate this sort of thing. If a man had to go through the female hormonal cycle, I can tell you right now, we would all jump out of the window. First day, because a male nervous system is not cyclical, it's in a straight line. For a female, the system is up and down, up and down, up and down, a bunch of times throughout the year and on a monthly basis. So when a woman's hormonal imbalances happen, the ovaries grow cysts, and instead of it normally popping up and releasing the egg into the fallopian tube, they stay there and they grow pus and hormones in there. There's all sorts of terrible mixtures. It messes up with a woman something terrible, and it's very painful. Okay, that's what they're talking about when they're talking about ovarian cysts. Okay, medical term for egg is OO. OO. So we have OO for eggs, oophouro for ovaries, and ovo. Okay, you got the fallopian tube salpingo. Uterus has utero, metrio, and hystero. Has anyone ever heard of any words in the English language that you use probably all the time, but don't pay attention to them, that has a root hystero in it? Anyone? All right.
No?
Hysterical. Wow. Hysterical. And what is the meaning of the word hysterical?
Funny-ish.
Funny. Funny or funny-ish. Oh, I went to see a movie and it was hysterical. Now, I want to tell you something, that there's nothing funny about the word hysterical. It is actually used to be a medical diagnosis. Just
For
like
a
today.
woman.
Huh?
Wasn't it a bad word that they used to use about women when they locked them up?
Well,
like,
it wasn't. Yeah, it was. Yeah. That's right. So, the terms hysterical female were applied all the time. Today, we call it something else. In some cases, it's a bipolar disorder. Sometimes, we call it today, what do you call it? PMS. Okay, so we have all sorts of interesting terms which are applied. But hysterical literally was a mental disorder. And you know how they used to treat this mental disorder in women? It wasn't just to lock them up. They would perform this procedure. A hysterectomy. What is a hysterectomy?
A procedure to cut out the uterus?
Thank you. So if a woman was particularly funny, they would yank her uterus out. It ain't funny, but you know, this is just you know. But look, we walked away from some of these things, and mind you, some of these procedures were actually successful. Otherwise, people wouldn't have done them. Okay, so hysterical literally means related to the uterus. Okay, or hysterics used to be hormonal driven mental psychosis of some sort. Okay, so this wasn't funny. Okay, so today, next time you use the word hysterical, think of what I'm talking about here. Okay, so vagina is a birth canal and birth canal only. Now, I would like to mention something about this piece right over here. This, my dear friends, is the cervix. And those of you who were here in the previous class, you know that the cervix means neck. Remember that? Remember? Well, there's a reason why this is called the cervix, because it looks like the neck of the uterus. I'm going to erase this, and I'm going to put up a medical term on the board. Oh, one of my favorite medical terms to throw up on the board. Ready? Can anyone pronounce this word? Come on. Don't be afraid. Take a shot. I won't hold it against you. Neither will anyone else.
Salpingo-forectomy?
Thank you. That was like perfect on the first try. Now, can you tell me what that means?
For scalping, I'm assuming the tube and the ectomy to cut out. So cutting out the procedure to cut out the tube, or no?
Is there anything else they're cutting out? Look at your notes. Take a look at your notes. All these terms are there. So the way you said, oh, very good. So, fallopian tube, ovary, cut out. So, salpingo-oophorectomy, I threw in a little Spanish pronunciation in there. I did it for a reason. Don't be afraid to pronounce these words if you're speaking English as a second language. Don't be afraid to sound out this word with whatever native accent you have. Don't be afraid of your accent. Pronunciation is the key. Okay, everyone is going to understand if you say salpingo-oophorectomy. Okay, it doesn't matter what accent you have. Salpingo-oophorectomy. It doesn't matter how you say it. You say it, you pronounce it. Salpingo-oophorectomy. Salpingo-oophorectomy. And then slowly but surely you will get into and you will be able to say it together, salpingo-oophorectomy. Again, I'm telling you, the more you are able to pronounce these large words fluidly and fluently, you are earning more money. Why? Because once they see you can actually say, understand these words, that means you are smart. That may not be true, but that's what people assume. That's how I got into most of my management positions. Not that I knew what the heck was going on. I was just able to flash every so often a little bit of brilliance. And that would be all I had. And I would be able to beat out other people 4 positions just because other people assumed I knew more than I actually did. Why? Because I was able to express myself. And positive personality. If you have a positive personality, you're not a boat rocker, you're a good guy, good gal, you're in there, okay? They don't want a boat rocker. They don't want to know it all. They want somebody they can trust. They want somebody who's not going to undermine them. Okay, just remember what I'm telling you. Okay, so that's what you have here. And that, my dear friends, is, oh, well, you know what, let me throw in a little bit more about the female reproductive system. Let's have a look-see on the outside, from the outside in. I gave you the inside look. Now let's have a look on the outside and a few more medical terms that go along with it, just so you understand what, where, and how. Now, this is the outside business end of the female reproductive system. This would be the anus. This opening, only this opening right over here, would be the vagina. This would be the urethra. And notice, and right here is the clitoris. Okay, and these would be the breasts. Okay, now breasts have a medical term, mammo and masto. Like women after a certain age go for a mammogram, which is an x-ray of the breast. Or if, God forbid, they find a cancer in there, women will have a mastectomy. Now, urethra, that was the part of the urinary system. Vagina was the part of the reproductive system. Ladies, they are separate. Women do not pee from their vagina. It's in a very close neighborhood, but that's not where it's at. Okay? There. There you have it. And this is it. Make sense? Oh, the area between the female genitalia and the anus, this area is called the perineum.
Perineum.
Anyone ever heard of this term?
Yes.
Well,
Yeah.
under what circumstances? Well,
Washing.
a what?
Well, I'm a CNA, so washing
okay.
dates somebody, so.
All right, okay, that makes sense. Well, let me tell you what it means. Perineum. I mean, who came up with a word like that? You know, I'm telling you, these doctors and people who work with anatomy, they have interesting sense of humor and interesting imagination. Peri is a prefix, which is a good prefix to know, and something known as neum. Perineum. Peri means around. Around. You may have remember this word from geometry, perimeter. Okay? A perimeter. That's a perimeter. Measure around. That's what perimeter means. Okay? A periscope in the submarine. If you ever watched a submarine movie, they watch into this tube and they take a look what's up around. Periscope literally means look around. You know, when you break these fancy words down, they're really uncomplicated. You just have to break them down. And this is what this, conversation is all about. How to break down complex into simple. That's my goal. I know it sounds complex now, but when you review this video over and over again, you will see, hey, you know what? All of this makes sense. Now, neum literally means new. Around something new. That's what perineum means. It means around something new. Now, what's new down there? There ain't nothing new down there. It's all the same old, same old. Okay? Once you see it once, there's nothing new. So perineum, what's new? Babies. This area is always around something new. That's what they're saying over here. Okay? It's an interesting thing. You know, these folks, they give these names, and we have to deal with them. Okay? Perineum, somebody said, well, this part's around something new. This is the part that gets cut. If the baby's head is too big, sometimes they cut it right there. Okay? And, you know, to help the baby out. It's painful for the mommy.
Worst word in the human language.
Which one? Episiotomy?
Yes.
You sound like you speak from experience, but it is what it is. I don't know how my wife did it. She delivered one of our babies, and he weighed 11 pounds as he was born. Big guy. Just cranked him right out, and off he went. Just like that. She was just blessed to be able to do that easy. So, that right here is the female reproductive system. Now, let's deal with the male reproductive system. I hope you're not too offended by the pictures I draw. This is all medicine. This is how we work. One second, guys. And I'm drawing you the reproductive system as it pertains to the male. This is not drawn to scale, so please, okay? And folks, if I can draw these pictures, so can you. So please draw them with me. Dum, da-dum, dum, dum. The male reproductive system. Kind of looks like that. If you cut a guy in half and look at him from the side, this is what you would see. Well, I'm not going to get into all the details of the structure of the penis, okay? I'm just not. That's like unnecessary. Okay, but let's suffice it to say that this is the penis. There's no medical term for penis, so it's just the penis. But you would be thrilled to know that words like pen, pencil, and penicillin come from the word penis. Okay? I guess to people who first created a pen, they said, oh, gee, that looks like a penis. Well, it is what it is, folks, okay? And penicillin, apparently the molecule, if you look under a microscope, I guess to someone it looked like a penis too. I don't know. I don't know. Like I told you, these folks have a very strange imagination. It is what it is. It is what it is. Now, going through the penis, it's that urethra. This sac right over here is called the scrotum. Inside the scrotum are testes. This little pipe that goes from the testes through this little thing over here into the urethra is something called the vas deferens. This round golf ball sized organ is something known as the prostate. This right over here is the rectum and anus. This right over here is the urinary bladder. And this right over here is that same urethra. Now, I'd like you to see something that, what do testes do? Testes make male hormone and produce sperm. You've seen sperm. It's that kind of a cell right over here. Kind of looks like this. It's a little cell with a tail on it. I'll be discussing this a little bit more as we learn about the microbiology for sterile processing, okay? So, you know, just keep that in mind. This is what the testes do. Medical term for testes include testo and orchido. Now, orchido sounds like a flower, orchid. And that's exactly what it is. Flower orchid is named after testicles, or testicles are named after orchids. I don't remember exact sequence as to what happened, but it was Aristotle that gave the name orchido to testicles. Aristotle was a brilliant man, you know, so apparently the bulbs, when the orchids, before they bloom, the bulbs, they look like testicles, and that's why they're called orchids.
So they get orchids and we get hysterical.
Exactly. Or you get the orchids when you get hysterical and the guy doesn't know what to do with himself anymore. I don't know. Maybe it works that way. Maybe. I don't know. Trying to find a upside to all of this. But yeah, it is what it is. So there is no medical term for prostate. Prostate is the same thing. Urinary bladder, you already know. But one thing I want you to see, that the male reproductive system connects to the urethra inside the prostate. So for men, reproductive system and urinary system are interconnected. Now, folks, there's one other thing I also told you, that women, when they're born with ovaries, they already have all their eggs inside that basket. Okay, so women are born complete, while man always produces these cells. They always constantly producing. And that kind of leaves an indelible mark on a psychology of, and I guess we really are different species. You know, men and women are so vastly different. It's extraordinary. We're not the same. We are different. Women physiologically are vastly superior to men. The female nervous system, female hormonal system, and everything else within a woman functions differently on a totally different level. That's why women have their own physicians, known as gynecologists. Okay, they have a separate branch of medicine. And right now there's emergence of a male doctors who specialize in men, you know, but it's really not catching on too much. That would be called andrologist. Remember, we talked about android, man, andrologist. But for a woman, gyno means woman in Greek, and ology means study of. So there's a doctor that specializes in studying women and women only. And as far as delivering babies, there's also a separate branch of gynecology known as obstetrics. That's why they're called OBGYN. Obstetrics and gynecology. Okay, but for men, you know, this is what we are. And why am I telling you this? I told you that women's hormonal cycle is cyclical. It goes up and down, up and down, up. For a man, it's always a straight line. We're constantly producing while women are constantly maturing and releasing. And the man always produces. That is the key difference between our two species, even though we're human beings, but that's where the similarities end. Okay, we're humans, but we're different humans. Men are from Mars and women are from Venus, from a standpoint of a book. Okay, worthwhile remembering, we are not the same. We're not the same. We're not equal. This is not to say who's better or worse. It has nothing to do with any of this. Okay, this is just as long as people realize that you're in one place, we're in the other, and this is how the world is structured. As soon as you realize that, everything is going to go smoothly. Okay, you don't have to be one over the other. We're just in different places trying to accomplish the same thing. So that's what we call a cross-functional team in sterile processing, is when we have different people with different viewpoints in life trying to do the same thing. And what is that the same thing? All the people, all humankind, all we're trying to do is just raise a family. At the end of the day, it's what's for dinner. Okay? So that's where we are. Now, vas deferens. Why is it even on the board? Why am I telling you this? Oh, by the way, why did I tell you, ladies, that all of this stuff is here? Why is the urinary system for a man is united for its reproductive system? Ladies, this is for you to understand. Men, if you don't understand this, you will understand this now. Prostate is a gland that assists a man in his, how should I say, orgasm. Okay? It squeezes, and by squeezing, it pumps out semen, which is sperm cells mixed with other fluids, okay, out of the penis and inside of a female for reproduction. Okay? Now, that prostate operates together with a bladder. So every time a man goes to pee, ladies, we are reminded of you. When a man goes to the bathroom for number 2, the poopies come out this way, and they also touch the prostate. And once again, we think of you. Okay? I know it kind of sounds gross and not romantic, but when you couple it with a constant, unrelenting production of sperm cells that are designed to do one thing and one thing only, and that's to impregnate a female. Now, if you put it all together, men, you will understand your psychology, and women, please understand male psychology. There's absolutely nothing in this world that we want except to get you people pregnant. Make sense?
Yes.
Women, once you understand that, you know, this is how I explained the world and how it works to my daughters. Okay? Said, girls, don't think that any men out there are interested in being your friends. Every man just wants to be in your pants, and this is why. Okay?